not that easy to get into, to get your mark, not that easy to make money. A lot of the product lines are established. So if you're a newbie and want to make vaccines, not that easy to break in these days.
As Canada faces the prospect of an Indian COVID vaccine export ban, the question of why Canada isn't producing COVID vaccines domestically has returned. But those studying virology and global trade say it's a difficult business to be in.
The largest producer of vaccines in the world is the Serum Institute in India. And the Serum Institute has a cost advantage because it's in India and wages are lower there than they are in Canada or elsewhere. But it also has a cost advantage because it produces at scale, and it can drive down average total costs.
William Mitchell from the University of Toronto says it's not just low costs that give India's Serum Institute the advantage. Because the Serum Institute is able to sell at low prices, it has a long list of customers. With consistent orders rolling in, the Serum Institute can refine its techniques, ensuring high quality in high volumes. Mitchell says Canada does have domestic vaccine manufacturing, but it's not tooled for COVID vaccines, and switching track may not have been possible before vaccines were approved.
Do you retool for an mRNA vaccine from Pfizer-BioNTech or from Moderna? Do you retool for an antiviral vaccine from AstraZeneca? Do you retool for something else? So where do you place your bets? We can't do them all. There just isn't enough. There isn't enough. It's not even money. There isn't enough time and capacity to do them all. So you're placing big bets on what might work and what might not work.
Vaccine production, drug production tends to go where it's favorable with the local laws and the cost and the regulations. And Canada, we've got very high standards, but we don't really favor novel drug development with the way we remunerate right now. So you don't want price gouging, but if you have price control, you're limiting the interest of those who want to make such products.
Dr. Earl Brown is a retired virologist and says the reality is that simply building vaccine manufacturing capacity for a rainy day would be extremely costly, before even considering the difficulty of competing against the Serum Institute for global customers. He says Canada's patent laws also favor generics rather than new drug development. Brown says it's possible for Canada to build capacity for future pandemics, but it'll need careful government participation.
You'll have to get government involvement, but you have to be nervous about getting government to make industry. We've been that route before, and you want to be careful you don't get into lame duck companies and that sort of thing.
In Ottawa, Xiaoli Li, City News.